The Beyeonics One visual microscope, there has no comparison to other systems previously. It is a completely new device. There is no legacy component to it. The one distinct advantage is the headset. You're not staring around a microscope arm or the actual optics that tend to block a 3D system that is typical in other 3D headsets. The headset with the Beyeonics exoscope has no bearing whatsoever on our ability to operate, and in fact, in many regards, it's quite comfortable and very easy to utilize. The benefits for IR, at first blush, is the opportunity to see a better edge effect with aspects of surgery that can become quite complicated, in particular, creation of a manual rhexis. I think that in and of itself is a huge advantage. There's also the opportunity to see the edge of nuclear fragments for phaco disassembly. And beyond that, I also feel that with reduced illumination and using the IR, there's going to be a much more comfortable surgical experience from the standpoint of a patient. You asked the question about ergonomics, and I'm shaking my shoulders, and that's really what it comes down to, is the ability to kind of sit back in a chair and not have to peer across the surgical microscope or have kind of a slanted view because of the arm of the scope. And so when you're able to have an immersed surgical view, it allows the body to relax. The shoulders drop, the hands and elbows tend to be a little less tense, and therefore the process is easier. My bit of advice for early adopters or those who are interested is lean into the relaxation. Sounds somewhat bizarre to say it that way, but the real advantage is to be able to be ergonomically more comfortable. And so I think you should start from there and then work towards your typical surgical processing, because that's really ultimately what we want, is a more comfortable surgical experience, which then should translate into a better outcome for the patient. I could summarize the Beyeonics in one word. It's amazing.